This is the MyHeart.net podcast. This show is produced by Dr. Philip Johnson in conjunction with VitalEngine.com. Please welcome your host, Dr. Elaine Bouchard, a cardiology specialist of Birmingham, Alabama, at St. Vincent's Medical Center, part of Ascension.
Well, welcome to our podcast, Arts in Medicine. And with us today, we have two fabulous ladies. The first one is Kimberly Kirklin, who's an artist and also director of the UAB Arts In Medicine program. The name Kirklin is very famous in Birmingham. Of course, she was preceded by her grandfather, Dr. John Kirklin, who revolutionized pretty much cardiovascular surgery with the development of the heart-lung machine. And it was chairman at UAB Surgery, as well as her father, Dr. Jim Kirklin, who's also a friend of mine, who's a cardiac surgeon at UAB and has made some significant contribution in the field of heart transplant. And then also we have Dr. Rachel Easterwood, who's a classical musician and an internist who specializes in intensive care medicine in New York City. She's famous for her segment in the New York Times during the height of the pandemic in 2020, where she brought music and hope to her COVID patients. So Rachel and Kimberly, welcome to MyHeart.net, and thank you for taking the time on this beautiful Sunday afternoon.
Thank you so much.
Thank you.
So Kimberly, let's start with you. What is exactly Arts in Medicine, and how did you get involved in that?
Yes, well, Arts in Medicine falls under the umbrella of Arts in Health, which of course is the use of arts and creativity to enhance health and well-being. And Arts in Medicine specifically tends to be more focused in healthcare, but it can be done in community settings as well, and with various populations. But really it is under that umbrella of arts and health that aligns, of course, with the World Health Organization's definition of health, which of course we know is that it's not merely the absence of disease, but it's the health of the whole person. And so we align very closely with that.
So I can understand how you grew up in the field of medicine. How did you go from being an artist to decide to, get involved in arts and medicine?
Yes. So I always knew that I was probably not going to be a physician or go into healthcare as a healthcare provider. But my passion was always arts and music. So I have my undergraduate degrees in music and musical theater. And I found my way into the world of arts administration. And so I had the great fortune of starting to work at the Alice Stevens Center, which is a performing arts center, of course, and at University of Alabama at Birmingham, and just fell in love with being not only, of course, on stage, but also in administration behind the scenes. So I was able to go into arts education and really was continuously just in awe by the power of the arts for children in schools, communities, and that led to an exploration into arts and creative aging. So arts is a part of the aging process to keep ourselves healthy cognitively and, of course, with mobility and other areas. And so that was kind of a foray in 2011, and then we started a pilot program in 2013, and now we have a full program, of course. But really, it's the power of the arts in so many different areas that it just, if I could see what the arts did for people in education settings, just was really fascinated by what it could be done in healthcare and specifically around health and wellness.
Very good. Rachel, I know your parents very well, of course, and they always thought that they were going to have a musician in their family. I mean, your whole development has been with music, and you could almost become, a concert pianist. And all of a sudden, you took this 180-degree turn into medicine. How did that how did it happen, or how did it?
Yes, first of all, thank you for having me here. It's great to talk to you both. So it was kind of a process that changed from music to medicine. I did go to conservatory for undergrad and also played professionally for a little while. But I kind of became disenchanted a bit with the music scene professionally. I sort of found the limit of, who you could reach with classical music. I tried several things, but I sort of wanted to reach more people and quote unquote help more people. I think, my idealistic young self. So I thought, well, why not go into medicine, where you can pretty much help, quote unquote, help everyone. So I started my journey into medicine. Little did I know I would find the limits of medicine during the pandemic and then go back to music to bring to everyone then. So it's been kind of a full circle, actually.
Very interesting. We know that for a patient that is admitted in the hospital, it can be very depersonalizing. I mean, you have first thing that happens is they put your personal belongings in a little plastic bag that they store in the closet, and then here you are, naked with a hospital gown and with people coming in and out of your room. And during COVID, particularly, even more so, particularly that there was so much isolation. They were not allowed to see anybody, any of the family members, any friends. So it was a very, very difficult time. Can you explain to us a little bit how, what happened during the pandemic as you were treating these patients in New York City?
Sure. I will preface this by saying I was in a hospital across the river from the Bronx. So we were hit particularly hard by the pandemic. At some points of the pandemic, basically the entire hospital were hospitalized COVID patients. The ICU had overflowed into our PACU, into our step-down unit. We had intubated patients on the floor. We had, teams of intubated patients downstairs. I was doing ICU rounds in the ER sometimes. So we were hit very, very hard. So I basically just seeing, we didn't know the natural course of COVID at that time. It was brand new, right? As we all know. So it was interesting and terrible at the same time to see, kind of how this disease played out. We thought we were supposed to intubate patients, as soon as possible initially, not knowing later on that most of those patients wouldn't survive. And the patients that did survive had prolonged courses, 4 months, 5 months intubated in our ICU. So I sort of just, we were at a loss because we had no real treatments that showed promise at the time. So the only thing I knew to turn to in talking with my friends over Zoom during the time that are in music currently, professionally, we just had this idea to bring live concerts to these patients that were, as you said, isolated, alone, scared. They didn't know what was going to happen to them, and we didn't either. So we just started, first of all, playing concerts for these patients over Zoom in their rooms. And then I started to bring it to the ICU. And every time I would have a shift, I would just, have these concerts over Zoom, and I would place the iPad in 3 or 4 patients' rooms. And my friends, the professional musicians, would just play for hours. And notably, I would say 3 of the 4 initial patients we did this for, I have no idea if it made a difference. I hope it, brought them comfort, if nothing else, but they did actually. 3 of the 4 made it out of the ICU, which is saying something. And so, that was actually good odds for the time. Not sure if that answered your question.
Yeah.
It's a long-winded description.
If everybody has a chance to kind of look up Rachel Easterwood, MD, and look at your YouTube, segment, it was very, very powerful. And particularly, I remember at the end, you're sitting alone, in front of the camera. And then you're saying, if I don't make it through this, maybe this is what I was meant to do.
I forgot about that, actually. I haven't watched that in a really long time. But yeah, that was definitely the sentiment. We didn't know what was happening. And yeah, exactly.
Yeah.
I felt like I had done what I was supposed to do. Yeah.
That was followed by a very long silence. And you finally looking down, at the floor. And of course, it could have ended there, but I think smartly enough, they didn't end it there. They followed that by how music was actually not only helping the patients, but also the co-workers,
Yes.
the nurses that were there, the doctors
Yes.
that were there. So that was very, very powerful how music, can help not only the patients, but also people around you.
Yes, exactly. Just going back to playing music for the coworkers, obviously it wasn't just the patients that were under a lot of stress and scared and not knowing what was happening. It was the coworkers, and especially my ICU nurses. They saw the worst of the worst. People would just start, crying in the middle of shifts when we would lose patients. Just so many patients were lost. So, we had the idea, again, talking on the phone with my musician friends, that we could just, put a speaker in the middle of the ICU and have people play. And the nurses and we were the only ones there overnight. It was the nurses and me. So they really, really, they would ask me, they're like, can we have music tonight? So that sort of got us all through the pandemic, or the first couple of waves. Yeah. Or it helped at least. Yeah.
I'm sure it helped a lot of people. I'm sure so many people suffer from PTSD. Some of the hospital workers, having seen so much, mortality in a short period of time, very difficult to handle.
Yeah, definitely.
Yeah. Kimberly, you're at UAB now, you're director of the program. How do you actually integrate arts in medicine at UAB?
Yeah, so at UAB in particular, we have a team of about 5 artists in residence. So they're professional artists, so not to be confused with creative arts therapists. These are professional artists who are trained to navigate the healthcare environment and to connect with people using their art form. So what does that look like? We have artists, and when I say artist, I mean the broadest possible term. So we have people who are theater artists, storytellers, visual artists. We do have musicians who play in public spaces to enhance the physical environment. UAB, I will say, has an amazing music therapy department that is separate from us. And so they've had that there for many years, and they're just extraordinary, wonderful. So just want to highlight them, but we are a separate department, but we do have music in public spaces as well. We have creative and expressive writers. And so that looks like either going to the bedside to offer an interaction, or we also do group workshops as well. But when an artist goes into a patient room, going to the bedside, really what we're looking to do is to recognize that person as a whole person. So, of course, we might not even know what the diagnosis is, because unless it's going to impact the way that we engage with them, the diagnosis does not matter to us, because we're not there to provide any sort of therapeutic intervention. We're there to connect them with who they are when they're not in the hospital. So really connecting with their essence, that whole person with hopes and dreams and family. And we use our art form as that connection. And so it can look like the patient may be a witness to art. So could just hear a story. And usually when they hear a story, it creates stories for them. They might then bring up a story that's important to them. Or it can look like engaging in embroidery, sewing, visual art. So it might be someone facilitating creative interaction. And so that is what it can look like at the bedside. And then we do a lot of group workshops as well. So we do a lot of work in our Center for Psychiatric Medicine, doing dance and movement, theater, and of course, visual art, and also writing as well. And we do a lot actually with adolescent psychiatry. And so they really connect with those forms of arts engagement. That's those forms of creative expression, because a lot of times they might be expected to engage in talk therapy or that kind of thing, but rarely do they get the opportunity to truly express themselves through another modality. And so that can be really powerful as well. Also, we do a lot of work with women with high-risk pregnancies, and of course, moms and dads who have babies in the neonatal intensive care unit, because another benefit of arts is, of course, that human connection that happens in so many forms. But when you bring together a group of women who have all been in the hospital for days, weeks, possibly longer, dealing with a lot of stress and anxiety, and bring them together into a group to create art, it also happens to create an informal support network. That's not necessarily our intention, but that happens when you have people creating art, sewing, that kind of thing next to one another. So those are just some examples of what we do. We also, like I said, we have music and arts exhibits in public spaces to, again, enhance that physical environment. We always know something is working when we have a performance, and people will stop, whether it's a visitor, a patient, or a healthcare provider, stop and take some video in the hospital of a performing artist, because that tells us that's kind of taking them outside of that, that hospital healthcare space. And one thing we do that's really fun that y'all might appreciate, we every year we do something called Medical Music Day. So we've done it for 3 or 4 years. Pandemic, of course, kind of threw things off a little bit for us, but we do Medical Music Day where we engage healthcare professionals, administrators, medical students, nurses, anybody who has some impact on patient care, environmental services, facilities and maintenance. But we invite them to, if they have a musical talent, to perform in the lobbies and public spaces. And we ask them to wear whatever uniform they wear to work, and we put their name and what they do in the hospital up there as well, so that it really humanizes the staff. And so patients and families can see, oh wow, maybe that's my doctor, or that's my future doctor, and one, and they do things other than just patient care. So we do that as well. And but yes, really just to enhance healing and to enhance the physical environment as well.
So if you're a doctor working at UAB, how do you get arts and medicine involved? I mean, is something you write an order for it, or you discuss with the case manager? Or?
Yeah, so there are a few ways. So we are, people can do a consult or referral for arts and medicine services through the electronic medical record. So we do see patients that way. We do have units that we go to regularly, but we also, people know us, and so sometimes different groups will engage us to do some self-care kind of work to support the healthcare staff and healthcare providers. So we support providers and healthcare staff as well. That's part of our mission. But for example, coming up this week, there are it's National Nurse Practitioner Week, I believe. And so one unit wants to celebrate 2 of their nurse practitioners. So we're working with them to do some sort of engagement with them and something celebratory. So we have information around the hospital. Of course, what we provide is free to everybody, and so we always get excited when people reach out to us to support their work and their needs.
I'm sure you're going to get very busy during the holidays because, who wants to be in the hospital during the holidays? So, having something like Arts in Medicine, probably very timely and healing, at the same time. Rachel, post-pandemic, obviously now you're an intensivist. Have you carried, forward some of these, some of the steps that you took into bringing, music and art in your environment in New York?
So personally, I haven't done a lot of work. However, my musician friends and co-collaborators during the pandemic have actually taken this new project called Project Music Heals Us. And I think they're currently in about 20 or more medical centers, like major medical centers across the US right now. So they're actually officially making this a movement, actually. So for me, I was the primary go-to during the pandemic for the music and the medicine. And it's just hard to keep up with both of those things day to day. Especially the hospitals I'm working in right now are more community hospitals and really busy clinically. So I'm pretty much just running around doing medicine things during my work days or nights. But I think one thing that, Kim, you were talking about, just, looking at the patient as a whole person, I think that is something that really is so important and really gets people lose sight of that. Doctors lose sight of that when patients are staying in the hospital or just in general. And I think that's just something that's really lovely and something to try to keep in mind. And I really try to keep that in mind on my day-to-day practice.
Very good. Well, let me ask both of you then, can art heal? Obviously we don't expect art, to treat cancer, but, in what ways art helping in medicine?
Well, I think that we already kind of covered this, but music, for example, or any type of art where the patient can participate, meet other people, or just, get their mind off of the hospitalization, I think that provides a level of comfort, which, it depends on what you believe. But I personally believe that if you can make a patient feel comfortable, like a human, that they are during their stay in the hospital, I think that definitely helps in healing. I don't know how much. I don't really care how much. If they think it helped them, then it helped. So that's the way I think of it.
Yeah, and I'll just add to that, because I, of course, agree with Rachel completely. But I would say also that we certainly talk about healing versus curing. And yes, I agree that we're not going to be curing any diseases, cancer, with the arts. However, it is healing. It can help with meaning making. It can provide people with a sense of purpose, self-transcendence. Certainly, I always, whenever I'm in a setting, seeing a beautiful music performance with, an audience, I experience that self-transcendence regularly. People talk about flow as a part of creative practice. And so that is very healing. And of course, that human connection. As we know, isolation can lead to early mortality. And so all of these things, there is evidence-based that supports that those provide healing for people. And it also happens that the arts can create that as well. So I believe it's a perfect marriage between the two.
I think that's very well said. There's so many reports on improvement in pain management, as well as, increasing resilience. We always say that in the medical treatment, really half of the treatment is coming from the person, from themselves. And I think arts in medicine really kind of helps, develop that and really kind of culture that, and helping, the medicine, working in these patients and having good outcome, But what's in the works in the future? What kind of research is going on in that field, Kimberly, in particular, in your program at UAB, and Rachel as well, if you had, kind of some input into that.
So personally, I think I'm given a lot more credit than I should regarding, the evidence of music and medicine, et cetera. I really am not currently, abreast of the research in that area. So Kim, I'm curious to see what you have to say about this.
Yeah, well, so there is growing research. The field is really continuing to expand. So the field of arts and medicine per se is about 35 years old. But it's been really increasing over the last, I would say, 10 years. There are a couple, two of my favorite arts and health researchers are Dr. Jill Sankey, and she's out of University of Florida. And then there's also Dr. Daisy Fancourt, who is at University College London. She's a psychoneuroimmunologist, and she does some really amazing work looking at all different types of art. One of my favorites is a study she did, small study, but looking at the impact of group singing on not only quality of life, because there's of course lots of research on quality of life in the arts, but really on how it impacts the immune system and immune function. It of course reduces cortisol levels, but also different immune function indicators were improved after basically 3 months of group singing. And so, and then of course, music therapy has some wonderful research around it. But Dr. Daisy Fancourt actually did a scoping review of the impact of arts and health for the World Health Organization, the European division, in 2019, and found that while there's still much more work to be done in the field, it really can help with the kind of delay onset of mental illness and help with the management of mental illness. It can also be an important factor and helpful in the treatment of both acute care and end-of-life care. And it also can help with age-related physical decline. There's some great groups. There's the Sound Health Network that Renee Fleming, the, of course, famous opera singer, she's a part of. That's also the NIH is a part of that. There's also Epi Arts, which is from the University of Florida, where they're looking at the impact of arts on health and community. And then there is also at Johns Hopkins, the Arts and Minds Lab. And particularly, they've got something called Neuro Arts, where they're really, they're doing a lot around just measuring really the impact of the arts on many, many different areas of health. So it's a very exciting time to be in arts and health because the research continues. And actually, UAB Arts in Medicine, we have a wonderful partnership with the School of Health Professions, particularly occupational therapy. So we've got a grant from the National Endowment for the Arts, really looking at the impact of a twice weekly theater class program for senior adults over a 10-week period to look at the impact or possible impact on cognition and mobility. And it's a controlled study. So we're still in the midst of that. We're also, we did working on a study it's around expressive writing. And so that is a 10-week program for people with spinal cord injuries to look at the impact of expressive writing on grief, quality of life, satisfaction with life. So that's another thing we're working on. And we've got some other projects. We've got an ongoing project that I'm hoping to wrap up, but looking at a twice weekly embroidery interaction for women with high-risk pregnancies, just to look at how that impacts patient experience, which we know is very important for hospitals and reimbursement. And so looking at the effect of that, it's a controlled study as well. And also kind of the same thing, but with bone marrow transplant, a twice weekly storytelling interaction. And that's been fun because that's a collaboration with my father's research group. So that's, I'm really hoping we wrap that up. We're hoping to get a total of 100 patients enrolled in that. And so we're getting close, but.
Wow.
That's so amazing. That's so amazing.
Yeah. It's pretty incredible. It looks like future of arts and medicine is very bright. I mean, there's so many projects, so many research going. It's pretty amazing, you know. Well, Kimberly Kirklin and Rachel Easterwood, thank you so much for joining us today for this podcast on arts and medicine. I feel like at the end, we should have Rachel play us, a piano piece from, Mozart or Beethoven.
I need forewarning for that.
Yeah, plus you see that you're in the kitchen and nowhere near your piano. So.
Let me find my piano. No, it's not in the kitchen. Yeah.
Thank you very much. And, we really appreciate your help. What a great work you're doing, both in the ICU and Kimberly at UAB. Congratulations.
Thank you so much.
Yeah.
Thank you.
Thank you.
To learn more from our team of cardiologists, please visit us at MyHeart.net. You can also follow us on social media by searching MyHeart.net on Facebook and Twitter. And be sure to subscribe to this podcast so you don't miss our next episode.